Hi, my name is Malfi Boro, and for my signature assignment, I will be presenting systematic lupus for my science and 40 class, also my physiology class. So to begin with, I'd like to kind of give a brief overview. So, what is systematic lupus? Systematic lupus erythematosus is an autoimmune disorder. So, systematic lupus has like a couple different names, like lupus, SLE, and also systematic lupus. Lupus essentially affects multiple parts of the body, so like kidneys, the skin, joints, and other stuff. It causes periods of inflammation and remission. So periods of inflammation is essentially flare-ups. It's often common for individual with lupus to experience like a lot of like flare-ups, and then after that they'll experience like a downtime of where they're recovering from that flare-up. Or as of right now, there's no cure for the disease, but it can be treated with medication and other like self care. To understand lupus, it's best to understand the physiology behind it. So when it comes to the immunity, there's two different types: adaptive and innate. With adaptive immunity, it's best to understand T cells and B cells. T cells and B cells are essentially like specific targeters that are specific. They help target specific cells and create responses to pathogens. With T cells, they can help identify and attack infected cells. Essentially, there's two main types of T cells: helper T cells, which activate immune cells by releasing cytokines and cytotoxins, and cytotoxic T cells. So those essentially kill off the affected cell, like the abnormal cell. Now, B cells, on the other hand, they'll produce antibodies that will bind to the pathogen and neutralize them. So it's like putting a marker on the pathogen. It creates memory cells, which allows it to have a much more faster and stronger response to the previously affected cell. So innate immunity has three different things: toll-like receptors, cytokines, and phagocytosis. These all work together to help promote innate immunity. So toll-like receptors are essentially little proteins on immune cells that will recognize certain pathogens. It'll then activate a certain immune response, which then leads to the production of cytokines. Cytokines help signal molecules that help create the coordinated immune response. So this will essentially create inflammation throughout the body. Now, phagocytosis is essentially it eats up the pathogen and any debris that is left by the cytokines. Is often done with like neutrophils and macrophages. They'll essentially eat up the rest of the like what's left of the pathogen or the rest of the pathogen to help kill it off. So understanding these will help you better understand the pathophysiology of lupus. Now, as for the pathophysiology, as of right now, the exact cause is unknown. However, according to the NIH, there are a couple reasons as to why for like it has innate immunity reaction or adaptive immunity reaction. So for innate immunity, what happens is that they believe that there are toll-like receptors on the cell surface that will detect DNA and RNA from dying cells, which then trigger that like production of inflammation and that immune response. Essentially, what happens is that it will send specific RNA and DNA and produce interferon alpha, which will help fight off that infection, but can also lead to like the production of like harmful autoantibodies, like self antibodies essentially. Now, another like belief would be cytoplasmic RNA sensors and DNA sensors, which will also activate that like production of interferon alpha and uh, and harmful autoantibodies. Now, another one is netosis. This is more involved with phagocytosis. So, what essentially happens is that um, neutrophils would release nuclear material after like absorbing and eating that pathogen, and this will essentially promote interferon alpha again, which is that inflammation. This will also promote like vascular damage, thrombosis, and make self antigens for T cells to essentially target. Now, for adaptive immunity, there are two possible reasons. The first is that the produced T cells are behaving a little bit abnormally. They're producing less interleukin 2 and causing more inflammatory molecules such as interleukin 6 and so on. Another reason could be due to the B cells are being activated when toll-like receptors are interacting. Essentially, what's happening is that the autobodies are essentially harming organs by constantly forming immune complexes that will trigger that inflammation and more cytokine response or cytokine release. Normally, these B cells are like taken away and already destroyed. However, in lupus, it is believed that the process for eliminating these B cells are like impaired, so it allows them to survive and constantly create that kind of like feedback loop where it's creating inflammation and just constantly being stimulated by like T cells and B cells. So the symptoms and like the symptoms for lupus, there are a multitude of them as it can affect like every area of the body. However, the four main symptoms are butterfly rash, lupus arthritis, neonatal lupus, and lupus nephritis. Now, butterfly rash is generally a rash that appear over the face. It'll go over like the cheeks, the nose, and sometimes the side of the forehead. It looks like a butterfly as per the name, and will usually happen during flare-ups. Another one is lupus arthritis. What's special about lupus arthritis is that it doesn't always show signs of arthritis, like the swelling signs or like the like oh it is just swelling, but it won't always show that swelling around the joints. Typically, it will just be that formation of like joint pain and stiffness, and this is often the case for individuals with experiencing lupus arthritis. Is that they won't show signs of it, but they'll be constantly feeling the pain throughout their joints. Another symptom is mainly for pregnant women. Pregnant women who have lupus can transfer that autoantibodies to their fetus, creating like little like circular rashes and cause heart problems and liver problems for that fetus. Another symptom is lupus nephritis. So essentially, it's the kind of like an inflammation of the kidneys. It leads to swelling in like the legs or the face, increase like blood pressure, create foamy urine, and so on. This essentially, if not treated, can really damage your kidneys. Now, for the diagnosis of lupus, it can be done through an immunofluorescence assay, which will identify nuclear antibodies. Essentially, it's a laboratory technique that's used to detect specific antigens and will essentially kind of like label them with fluorescent antibodies. Another way is through identifying the physical manifestations of lupus. So this will generally happen through flare-ups, and when going through the doctor will essentially to do some lab tests, but also identify like the butterfly rashes, um, sometimes like if experiencing pain in the hands. Other identifiers would be like when you have lupus, another symptom would be these little like disc rashes that will happen throughout the body. So for the treatments of lupus, there's a couple of treatments. Mainly, it can be done with medication. Known as one medication is Benelista. It's essentially a B lymphocyte stimulator protein, which will help the B cells kind of survive. Another one is with corticosteroids. So corticosteroids will mainly help with rashes and other like inflammation. Generally, it can be given through a cream. It can be given through injection, also through with oral medication. Now, for the demographic of lupus, it mainly affects women, especially those aged 15 through 45, but it's also common in African Americans, Hispanics, Asians, and Native Americans. Along with if you have a family history of lupus, i.e., like your grandma, your ma, or like any other family member, like an aunt or something, it makes you more predisposed to developing systematic lupus. So, yeah, these are my references, and I hope you have a great day.